Maryland Spotlight. It's all about Maryland living.
Welcome to Maryland Spotlight. I'm Kim Knight. Today our topic is breast augmentation, and joining me in the studio, Dr. Brent Birely. You are with Artistry and Plastic Surgery. Thanks for being here today.
My pleasure, Kim.
Now, people who are thinking about having breast augmentation, there are some new products out there. Can you tell me about that?
Yeah, actually the newest thing in breast augmentation is the newer implants that are available. Actually, in the last year, the FDA has approved what's called anatomical teardrop shaped implants, where actually the implant is much more naturally shaped like a breast is. Actually, this is an example of one of the newer implants, and it's rather than the older implants that were strictly round with just different degrees of profile, this implant actually has a greater projection in the lower portion of the implant, less in the upper portion, which is much more anatomical and gives them a much more natural looking result.
Yeah, because the older ones used to be just flat, and you could really tell.
Yeah, with some of the older implants, you definitely got a very unnatural augmented look because of the roundness of the implants, and this definitely gives a much more natural appearance.
Now, any concerns about the gels?
Years ago, there was concern about the gels actually causing people some health problems that they leaked, but there actually were numerous studies done which actually confirmed that there is no health risk associated with leakage of the implants. And actually, during that time, the manufacturers made a better implant, so they're actually less likely to leak. And even if it does, the gel that's inside is much safer than it used to be.
And it gives you good peace of mind. Now, tell me, when you're having this procedure, what is generally the downtime?
Most people, depending on exactly what they have done, are back to their normal routine with about 7 to 14 days.
Wow, that's really quick. Now, while they're having this done, is there any other procedure that can be done alongside?
Absolutely. Probably the most common procedure that's done at the same time is a breast lift, where if the breast is a little bit droopy, it actually is lifted up in order to give a more natural, more youthful appearance. And then sometimes a person will also get some form of a tummy procedure, where they need to get a tummy tuck done or some liposuction to the stomach while they're getting the breast augmentation done.
Now, how do you address concerns about people who are maybe concerned about their appearance?
Yeah, actually the internet has been very helpful with that, because now actually we tell patients to go onto the internet and actually find a picture of what they'd like their results to look like when they're finished. They bring that in for their consultation, and then I know what they want to look like. They have a good idea of what they're going to look like, and the satisfaction rate has gone up significantly with having people bring in pictures.
Terrific. Okay, well, Doctor, thanks for being with us today. If somebody wants to contact you, do you have a website?
Yeah, it's AIPSMD.com, and it stands for Artistry and Plastic Surgery.
Okay, 2 locations, Towson and Bel Air, correct?
Yes, ma'am.
All right, thanks for being with us today.
My pleasure. Thank you.
And thank you for joining us today on Maryland Spotlight.